I'm Oh Seong at the Arirang News Centre. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak here in the country. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation in English. We're going to go into the briefing room where Yoon Tae-ho, Director General of Public Health Policy, will be sharing the latest figures and updates on the COVID-19 situation in Korea. The government has been keeping us updated every single day with briefings about twice a day on the latest figures, the number of confirmed cases. It looks like the briefing is going to start soon.
We also have sign language translation available, and the briefing will be given by Mr. Yoon Tae-ho, the Chief of Quarantine Supervision Department of the KCDC. It will be followed by Q&A. Let us now begin our regular briefing for March 11th, Wednesday. As of midnight today, the total number of people who have been in quarantine due to COVID-19 stands at 7,407, and a total of 60 people have died. And I extend my deepest condolences to those who have died. And the number of confirmed cases yesterday was up by 242, making the total cumulative number to 7,755. So far, a total of 214,640 people have been tested. Today, we have convened a KCDC meeting, and it's covered issues ranging from our measures to deal with cluster transmission, especially at the call centers. And we also discussed measures for quarantine. And Mr. Bang Neung-hu, the head of the KCDC, explained and described detailed measures that need to be put in place immediately to prevent the further spread of the cluster transmission that happened here in Seoul. And this is applied not only to Seoul, but also to the surrounding municipal cities, including Gyeonggi and Incheon, which have a large density of population. Yesterday in Seoul, at Gurogu District Call Center, we witnessed a cluster infection, and here are the quarantine measures that follows. In the call center cluster transmission, we are currently conducting the epidemiological investigation, and we're carrying out self-quarantine on people who have been come into close contact with those who have been confirmed. As of midnight today, the total number of infected people here stands at 90, and I believe that this figure is subject to change as we carry out further investigation, and the exact statistics will be updated in the briefing this afternoon. And in yesterday's briefing, we also touched upon the issues of sporadic increase of the outbreaks in the long-term health facilities, as well as cluster infections at the call centers. And to this, KCDC believes that especially the call center at Gurogu District is very important, and there is a great need for these related cities to cooperate to curb the further spread. And the KCDC will also coordinate closely. We will monitor and come up with immediate measures to provide quarantine for the facilities like call centers, which are very vulnerable to cluster infection, because these call centers have a high density of people who are working there, and they sit very closely. Therefore, there is a high risk and high vulnerability for droplet infection. And there are also other facilities and businesses and offices that are very highly vulnerable to droplet infection, just like the call centers that we have seen. We will be urging these businesses to utilize teleworking as well as adjustment of the seatings so that they could sit apart from each other. And we will also asking them to develop a flexible working hour. And for businesses with a certain number of employees, we are also urging them to have hand sanitizers and regular ventilations, as well as checking of the body temperature and asking the employees to stay away from coming to work if they have symptoms like fever and other respiratory symptoms. We will also be designating an employee who will be monitoring these measures on site at the businesses. And the KCDC will provide immediately, as soon as possible, the guidelines for these businesses who are prone to cluster infection. And I believe that in order to address this, we believe that local government needs to cooperate closely with the local government, with the central government. And we believe that sanitary measures as well as social distancing is very important as well. The following is about the quarantine measures put in place for Daegu and Gyeongbuk province. As of midnight today, the newly confirmed cases in Daegu stand at 131, and we are witnessing a stagnant stabilization of the daily increase of the patients. And the life treatment centers have also newly opened its doors, and about 13 centers are nationwide to accommodate 2,358 patients so far with mild symptoms. Today in Jeonju, Samsung's training center will also open its doors, and Jeonbuk University Hospital will provide its medical services to this facility. We are currently completing the investigations and screening on the Shincheonji members, and we are providing more patient beds for these patients in the Daegu city, and thus we are seeing a stabilization of the increase of newly confirmed cases in Daegu. However, we still see a daily increase of over 100 patients, and we do still see sporadic outbreaks of the disease, so we believe that we cannot put our guards down as of yet. And for Gyeongbuk region as well, the on-day increase of confirmed cases stands at 18 as of today midnight, and they were centering around sporadic outbreaks among the long-term care centers and facilities. And in order to further curb the spread of the disease, we are carrying out further quarantine and self-quarantine measures. And as for the curbing of the spread of the virus among long-term care facilities and medical facilities, we are also designating respective people who will be responsible for monitoring these facilities. I extend my deepest gratitude to all of those who have helped us in preventing the further spread of virus in Daegu and Gyeongbuk province. The following is the measures put in place by each of the districts and provinces. When the people with suspected symptoms visit the emergency rooms, this will be very dangerous for others who need emergency care, as they will be missing the golden time. In order to prevent this, we are ensuring the swift medical services through the emergency center, as we will be designating emergency medical rooms for the COVID-19. And in front of these emergency rooms, we will be having another screening facility to screen these people who have suspected symptoms. And we will also provide medical staff with protective gears who will be accommodating to these patients. And looking amongst the increase of further spread of the virus, we will be designating future emergency rooms, and for these, we will providing them with additional incentives so that we can ensure that appropriate level of services is provided to the people. And the KCDC, in cooperation with other local municipalities, we will designate about 2 to 3 per district and provinces so that they could be up and running efficiently. And we also reviewed the case of Daegu and Gyeongbuk, and in order to reduce the rate of fatalities in these regions, we believe that it is most important to identify the high-risk categories. And we also established the special task force to go over and review the classification of these symptoms. And we believe that an increase of live treatment centers is also very important. And starting from tomorrow, the KCDC will continue on with our discussions on tailored measures for each of the provinces and cities. And not only for Daegu and Gyeongbuk region, we believe that we need to monitor and investigate and look deeply into the treatment facilities for these COVID-19 confirmed cases across the nation. So we will be taking preventive measures in order to curb the further spread of the disease, and we will exert our full efforts to this end. And COVID-19 is very unique in that it spreads very fast in the initial stages. So it is difficult for us to curb the spread of the disease, and we believe that public cooperation is very helpful. And we believe that, above all, complying with personal sanitary measures is very important, and social distancing is very important. And please understand that personal sanitary practices and social distancing is very important, so we ask for your participation to this end. And thanks to your support and the mature citizenship that you have showed so far, we will be able to overcome the coronavirus to a certain extent, and we will also put more efforts on a government level as well. Thank you very much.
Well, that was a government briefing on the current coronavirus situation here in the country. Authorities just reported 242 additional cases, bringing the total number of confirmed cases to 7,755. There have been a total of 60 deaths. That concludes our coverage of this morning's briefing. We will be back in just a little while at 12 o'clock noon with our regular newscast with Mark Broom. Bye for now.